Professor Nagel, you are the CEO of the Medical University Lausitz, Carl Thiem, and leading an ambitious initiative with the model region. Could you tell us a bit more about it?
Yeah, the Medical University Lausitz, Carl Thiem, is 40th state medical university in Germany. It is invented by the local state parliament of Brandenburg in the end of June of this year. And we did start with this new university on the 1st of July. We are going to look at the question of how is digitalization changing medical perspectives? How are digitalization technologies are relevant not only for diagnostic and treatment, but also for prevention? How could they guide us through a healthier life? How could we connect the ambulatory setting, the setting of local district hospitals, and care in a clinic of maximal medical technology? How could we connect the question of older and younger people, as we call them, difficult groups of our society with more endangered situations? So those are all questions we are trying to give answers to by this new medical university.
Which role do you see in the digitalization and to achieve your targets, and especially maybe also combining this with cloud?
Well, as I mentioned, digitalization will be, it's also by legislation, the main focus of the medical school, the medical university, in terms of provision of healthcare and science. So what we are looking at is what can we do today, and we will learn also from healthcare providers who are specialized in digitalization, what is relevant in terms of taking data from different areas of our health, what is relevant in terms of connection between the different stakeholders, and mainly what we can achieve to use this data for science. And we do certainly have in Germany the difficulty that we actually did not trust for the last two decades too much in that development. Yeah. I think we are far behind some of the areas of development. For example, in the electronic patient record, if you look at Austria, if you look at other countries, Estonia, they are far ahead of us. Nevertheless, we would like to adjust what the experience are there, to use it for our patient-oriented digitalization in healthcare. I will take it in that term, that we really would like to have not a professional-centered digitalization in healthcare, but a patient-centered digitalization in healthcare.
Patient-centered.
Yeah, exactly. So, and if you ask me about cloud, I'm not a digitalization expert. I can say that I've learned that the cloud technology really gives you two important aspects who I think are relevant in the development in general. One is security of data. I think that's very important to us, that we do have a secure base, also a secure base for people, that they know if I share my data in that sensible area, those data is safe and will be safe. Yeah. And the second one is sovereignty. How do we get a situation where our people in the Lausitz can identify with their data collection and with their data mining for this perspective of coal mining, their data mining to be regional autonomous, so that they really have an autonomy to use the data before it is shared with others. So those two things seem to be in the cloud technology relevant and possible, and therefore I think cloud technology will be helpful for us.
Thank you, Professor Nagel.
Thank you, Jens Dommel, for our meeting here today.